Our presentation is over medical disparities related to the Hispanic Latino population. The U.S. Department of Health and Human Services states the Hispanic Latino ethnicity derives from a person of Cuban, Mexican, Puerto Rican, South or Central American, or other Spanish culture. This population exhibits a collectivist value. In 2020, there were 62.1 million Hispanic Latinos, making up 18.7% of the U.S. population. However, in contrast, compared to Kentucky, it is one of the lowest populations, making up only 3.9% of Kentucky's population.
The Latin American population is primarily Christian, with the predominant Christian population being Catholic. Catholicism largely influences Latin Americans' idea of life and death, especially in regards to their beliefs in healthcare, especially with their fatalistic beliefs, believing that while God has a hand in shaping their fate and destiny, they ultimately have free will to make their own decisions about healthcare. This should definitely be enforced as we want these patients to show initiative and motivation for caring for themselves and taking responsibility for their own care. Another thing to realize with this is that they do not support contraception with their Catholic beliefs. So we can still ask to see if maybe they have an exception to this personally, but we don't want to press this at all. And when talking to adolescents about contraceptive methods and such, we want to make sure that the parents are out of the room due to possibly having more conservative or Catholic beliefs than their children.
Dietary choices in the Hispanic culture are based on location, income, family customs, and education. Nutritional preferences are usually lower in fruits and vegetables, but higher in fat in the Mexican American diet compared to the traditional Mexican diet that's higher in fruits and vegetables and lower in fat. But many Hispanics still include core elements of the traditional diet, such as beans, greens, and fruit. In Hispanic culture, it's important to practice eating with the family as a whole, where the mom is primarily the cook. This is also used to build connection with the family. Breakfast is usually eaten early in the morning around 8 a.m. and as a smaller meal. Lunch is the largest meal of the day, usually occurring around 2 to 4 p.m. with several courses, such as an appetizer, main course, and dessert. Dinner is usually eaten around 9 to 11 p.m. and is a smaller course than lunch. Religion also plays a role in the Latino and Hispanic diet. For example, Catholicism is the preferred religion of the Hispanic and Latino population. During the season of Lent, which occurs around February to April and lasts about 40 days long, Catholics abstain from meat and fast on Fridays and Ash Wednesday during this season. This is important for nurses to remember so that nurses can make sure that meal trays do not contain meat if the patient practices these guidelines. It is also important for the healthcare provider and the team to recognize that Hispanics and Latinos typically eat later at night, so they may not want to eat during the designated hospital meal times. It is also important for the healthcare provider to incorporate a diet that follows their culture. And it is also essentially important for the whole team to include the family in the dietary meal times.
When a patient becomes terminally ill, it is common in the Hispanic and Latino population that the spouse, eldest child, or any other designated family member will be notified first before the patient. The designated family member will then decide if they want to tell the patient, and this is due to some people in the culture believing that when a patient becomes aware of the terminal illness, this will make them decline faster. The designated family member will then notify the rest of the family. It's important to allow the patient, if aware of the diagnosis, and the family to have choices of where the patient would like to die. Many people in the Hispanic and Latino population would rather die at home, surrounded by their family, and to ensure that all their cultural preferences will be done in the way that they would like. Many people also do not understand what hospice is or the services they provide. They think that hospice means going to a different location and that they can't help with what they desire for their death. So it is important as healthcare providers to provide them the education that they need. Religion is very important in the Hispanic and Latino culture. Some many will want a Catholic priest to be involved with their care. It's important to give a small report to the Catholic priest about the patient's diagnosis so that they do not provide the patient or the family false hope.
A major disparity among the Hispanic and Latino population is lack of health insurance. This population has one of the highest uninsured rates of any other ethnic group in the U.S. Only 51% of the population has insurance. The lack of health insurance has a negative impact on one's health. For example, individuals are not able to afford health care and therefore causes them not to seek preventative care, which results in chronic conditions to occur later on in life. One recommendation to address this healthcare disparity is to provide public access to clinics or hospitals where health insurance is not mandatory in order to receive care.
Another disparity related to the Hispanic population is communication. Communication is so important in healthcare because in order to help patients, the healthcare worker must be able to effectively communicate with the patient regarding medical problems, medications, medical history, and teaching. And when encountering patients who only speak Spanish, this becomes very difficult. Hispanic patients report less satisfaction with communication than those who speak English, and they feel as if their care is less family-centered. In order to make these patients feel more cared for, all medical forms should be provided in Spanish, and interpreters need to be available upon request.
Obesity is one of the most common health concerns in the Hispanic and Latino populations. Hispanic Americans are 1.2 times more likely to suffer from obesity than non-Hispanic white Americans. Obesity increases the patient's risk of diabetes, heart disease, stroke, arthritis, and cancer, which are very serious health conditions and could cause death to the patient. The solution would be to promote a healthy lifestyle in the patients, including healthy foods and an exercise regimen daily.
Latin Americans are largely at a greater predisposition than other cultures to diabetes, predominantly due to obesity and insulin resistance. They also face environmental factors such as inadequate nutrition and lack of leisure time physical activity. And because of an average lower income and socioeconomic factors, they lack access to proper insulin therapy to maintain proper control of their diabetes. To address this, lowering the price of these nutritional foods and insulin is a good first step, as well as proper nutritional teaching and diabetic prevention and maintenance of this prevention for these patients who suffer from this.
Another impact on health is hypertension. About 1 in 4 Hispanics have high blood pressure, also known as hypertension. Hypertension is a major contributor to cardiovascular disease or heart disease, which is the leading cause of death in the United States. Rates of hypertension treatment and control are typically lower in the Hispanic and Latino community all across the United States. A solution for this is to follow a heart-healthy diet, to seek a primary care physician, and monitor blood pressure on a regular basis. Also, education on high blood pressure and the effects it can lead to would be important as well, and taking prescribed antihypertensive medications.
Due to diabetes being a common health concern in the Latino and Hispanic population, the Dexcom G6 was created. It's the only integrated, minimally invasive continuous glucose monitor that takes the place of blood glucose sticks. It's approved for ages 2 years old and older, and it alerts the patient when the blood glucose level has become too high or too low so the patient can get the proper care that they need. It's accepted by many insurance companies, and there's also a low copay, but many people do not have copays at all.
Another technological advance in this population is a translator. And this is important because many people who speak Spanish experience worse health outcomes than those who speak English. So by implementing translators, we can improve patient satisfaction, reduce medical errors, and help the patient feel more cared for.
Key takeaway points is overall, the Hispanic and Latino population is very prevalent in the United States. Religion and family are also very important factors in their culture. This population faces several healthcare disparities, which limits healthcare access to common chronic conditions such as obesity, hypertension, and diabetes. Lack of health insurance also creates a financial burden for this population in accessing healthcare and receiving treatment. Several technological advances are improving in order to help face these disparities in which this Hispanic population encounters. And this concludes our presentation.